Hey, it's Liz off the Q Morning Show, and today I'm sitting with a very special guest.
Yes, Liz, I'm Dr. Candace Brown, and I am a professor at the University of Tennessee Health Science Center.
Thanks for coming, Dr. Brown. Now, you're working on a really special study right now. Can you tell us all a little bit about it?
The study that we're conducting is funded by the National Institute of Health and is being conducted at the University of Tennessee Health Science Center, as well as at 2 other centers in the United States. We are conducting a study on vulvodynia, which is pain in the outer vagina, which is characterized primarily by pain on intercourse, but also pain with tampon insertion. And as you might imagine, Liz, this disorder significantly affects a woman's relationship, her feelings of self-esteem, and her quality of life. This disorder is often under-recognized, even though up to 18% of women present at gynecologist's office. Gynecologists often are unsure how to treat this condition because there are not a lot of medications have been studied for this condition. And so it's an area that really needs further research.
Now, what should somebody do if they're interested in participating in this study, Dr. Brown?
Yes, I would like women that are interested in our study to contact the website hopeformypain.org.
Now, just to make sure everybody has it, what's that website again, Dr. Brown?
That's hopeformypain.org.
Is there a phone number that can be used as well?
They can also reach us, Liz, at 448-1500. That's 448-1500.
Now, is there a certain type and age of woman that vulvodynia typically affects?
Well, vulvodynia, Liz, can affect women of all ages, but most commonly it affects women of reproductive age. With our study, we are looking for women that are at least 18 years of age or older. And we are also looking for women, as we discussed, that have pain with intercourse and also have pain with tampon insertion.
Now, can women be suffering from this without even knowing that this is what it is?
Absolutely, because women will oftentimes go to physicians, and they will go to 3 physicians on average before they are diagnosed with vulvodynia, because physicians often are uneducated on what vulvodynia is.
Now, if a woman's hearing this right now and is realizing that this is what she's suffering from, what should she do?
What they would do, Liz, is they would go to the website, hopeformypain.org, or they would call 448-1500, and in both cases, they will complete a screening form which will let us know if this woman, if you that is, may be qualified for this study. And after you complete that screen, then you'll receive a phone call from one of my research coordinators to discuss with you further our research study and your continued desire to be involved in our study.
Now, does somebody have to pay to participate in this survey, or do they need to have health insurance or anything?
No, a woman is not required to have medical insurance. In fact, all of the medical care is provided free of charge during our study, and because we understand a woman's time is important, she'll be reimbursed $350 during the study if she completes the study. There are 6 visits over a 6-month period.
Are there any other medical conditions that come along with this hand in hand?
Okay. With vulvodynia, a woman has pain primarily in the outer vagina. Now, there are other conditions that are associated with vulvodynia. Women that have fibromyalgia are more likely to have vulvodynia, as are women that have migraine headaches, women that have irritable bowel syndrome. There are a lot of other disorders that are more common in women with vulvodynia, but as far as other symptoms with women with vulvodynia, it's associated with that area around the vagina. So it is pain with intercourse, it's tampon insertion, it's speculum insertion, it's any type of pain where there is pressure applied to the vagina. And another example would be sitting. Anytime there's pressure applied to the vagina, this causes pain to a woman that has vulvodynia.
Are there any women not eligible for this study?
Women that are not eligible for this study would be those that are not healthy in terms of they've got certain medical conditions that are not stabilized. For example, let's say a woman has high blood pressure. If her blood pressure continues to go up and down and it doesn't stay constant, then she would not be a good candidate for the study. If a woman has seizure disorders, she would not be eligible for the study. But primarily women that have a medical condition in which they have been stable for, let's say, a 3-month period are eligible to be in the study, with the exception of women that have seizure disorders.
Can a woman be pregnant and participate, Dr. Brown?
That's an excellent point, Liz. Women that are pregnant or at risk for pregnancy, women that are breastfeeding, these women, of course, would not be eligible because of women having risk of being on any kind of medication.
Now, what is gabapentin?
Yes, Liz. Gabapentin is the medication that we're going to be studying in our clinical trial compared to placebo or a sugar pill. And we believe that gabapentin may be helpful because gabapentin is used to treat other chronic pain syndromes, such as lower back pain, migraines, fibromyalgia. So we have reason to believe that this medication may be helpful.
Now, if a woman were to participate, is there any confidentiality agreement?
Yeah, that's another excellent point, Liz. And absolutely, there is strict confidentiality. When a woman signs what we call an informed consent, and the study is described in detail with this woman, and she's given the opportunity to ask any questions. In that informed consent, it states that none of this information will be released. It's all confidential unless we receive her permission.
Now, one more time, what was that website again?
I would like a woman to go to the website hopeformypain.org.
And the phone number again?
That phone number is 448-1500.
Dr. Brown, is there anything else important that women should know about this study?
I think it's important for women to realize that they don't have to suffer from this condition because it is so debilitating and affects a woman's quality of life, relationships, feelings about herself. What I would like to stress is that this disorder is treatable, that there is help out there, and I think that's a very important message to get across. And what I would like women to do is contact us at hopeformypain.org, and the phone number is 448-1500.
Thank you so much for your time, Dr. Brown.
Thank you, Liz.
Brown.